Tiger Woods is 48 years old and just had his 6th back surgery. I'm going to explain all of his surgeries, and if you are a spine patient, give you some solid tips to hopefully prevent this from happening to you. In 2014, Tiger underwent an L5-S1 microdiscectomy, probably one of the most common procedures that we do in spine. The disc is a cushion that sits between the bones in our back, and if you herniate a disc, a surgeon might have to go in and do a microdiscectomy where we remove the part of the disc that's come out of where it belongs. Our disc has a hard outer coating, kind of represented by these ropes, and if you tear that disc, like right here, some of that disc material may leak out and pinch the nerve. That can cause extreme sciatica. So in 2014, Tiger had his first surgery where he had that procedure done. Unfortunately, within 1 year, Tiger subsequently had 2 additional microdiscectomies from reherniations at that same level. And in 2017, he underwent an anterior lumbar fusion to remove that disc altogether. If someone has repeated injuries to their disc, they can continue to lose the disc contents, and then over time that disc can become progressively more collapsed and cause back pain. So we can go in and remove that disc altogether and put in a device that looks like this that allows us to raise the space up between the bones in our back and restore that height and eliminate pain. In 2021, Tiger then sustained a disc herniation at the next level, L4 and 5, and underwent a microdiscectomy. Unfortunately, we see that happen because his disc at L5 and S1 was completely immobile, so the next disc up took on that motion and can cause accelerated degeneration, and that's something called adjacent segment disease. In the lumbar spine, that happens anywhere from 2 to 14% per year. Just a few weeks ago in 2024, Tiger underwent his 6th surgery at the same level, L4 and 5, reportedly for a decompression or a clean-out procedure to alleviate pinched nerves. I feel for Tiger because I take care of patients like this every single day. Tiger is 48 years old and has had 6 back surgeries. So is there anything that I would recommend any of you guys out there to prevent the same phenomenon from happening to you? There are 2 questions that I would encourage you to ask your surgeon anytime you're having a microdiscectomy or a spinal fusion. Ask your surgeon if they use an annular closure device to help prevent from reherniation after a microdiscectomy. It's a device that can lower the risk of reherniation by 50% as shown by a randomized control trial. I've been utilizing this technology for the past 4 years in any patient that's a candidate for this procedure. And I can't help but think if Tiger had the barricade placed at the time of his original surgery, would he even needed these last 5 back surgeries? It's a totally valid question, and if he did not suffer that reherniation, he may never be where he is today. The last thing I would encourage to ask you is if your surgeon recommends a spinal fusion, I would ask them if they perform lumbar or cervical disc replacement as an alternative to fusion. Motion preservation in the spine is incredibly important to help fight against adjacent segment disease. What happened to Tiger is what happens to patients all the time. Be your own advocate, ask questions, and don't be afraid to get another opinion. I don't want to be naive here or misguiding anyone. Spinal fusion has its role in spine surgery in many, many cases. I perform this procedure all the time. Avoiding spinal fusion, if possible, is one way that we can combat adjacent segment disease. I am not providing medical advice. I'm just encouraging you to ask questions about your spine. After all, we only have one of them.